Hello, I'm Jaylin Chen. Welcome back. In the previous session, we talked about the assessment and planning part of performing urinary catheterization. Today, we will continue with the implementation and evaluation parts. First, let's talk about the implementation of the procedure. Before we start, introduce self and verify the patient's identity again. Explain to the patient what you are going to do, why it is necessary, and how he or she can participate. Then, perform hand hygiene and observe appropriate infection control measures. Help the patient to lie down, if not already, and ensure patient's privacy. While standing on the right side of the patient, we take off the left leg of the trousers and bring it over to cover over the right leg. Cover the left leg with the quilt or bath towel. Then help the patient to keep the knees flexed and hips slightly externally rotated to fully expose the perineal area. Place a disposable waterproof sheet on the patient's hips. Disinfect hands with hand sanitizer. Open the catheterization kits. Take out the preliminary disinfection supplies and put the receptacle near the perineal area. Put on sterile glove on your non-dominant hand. Put on antiseptic cotton balls in the receptacle. Then, we come to a preliminary disinfection of the perineum. For female, pick up an antiseptic cotton ball with the forceps in your dominant hand and wipe the mons pubis and labia majora. Then, use your non-dominant gloved hand to spread the labia majora to fully expose the labia minora and urethral meatus. Use new cotton balls to repeat the disinfection for the labia minora. Use last two balls to disinfect directly over the meatus and then over the anus. Use this time to locate the urinary meatus relative to surrounding structures. It is located between the labia minora, in front of the vagina and below the clitoris. The disinfection sequences are from outside to inside, from contralateral to ipsilateral, from top to bottom. For male, disinfect the mons pubis, penis, and scrotum. Use your non-dominant hand to grasp the penis at shaft just below the glans with sterile gauze. Then, fully retract the foreskin to expose the meatus. Disinfect the center of the meatus in a circular motion down to the base of the glans. Use new balls to repeat several times. Remove and discard glove. Disinfect hands with hand sanitizer. Open the independent inner package of catheterization kits and place it between the legs of the patient. Unfold the sterile drape. Put on sterile gloves. Place the fenestrated drape over the perineum and expose it. Establish a sterile field together with the sterile drape. Organize the remaining supplies. In the past, nurses pre-tested the catheter balloon and replaced it if the balloon malfunctioned. But nowadays, pre-testing balloon is no longer a common practice. because it may form a crease at the balloon area and cause trauma to the urethra during insertion. Lubricate the catheter tip and connect the catheter to urine drainage tube and bag if needed. Put the antiseptic cotton balls in the receptacle for repeat disinfection. For a female, disinfect the urethral meatus, labia minora, and then urethral meatus again in the same way as described in the preliminary disinfection. Please note, keep the labia separated after disinfecting until catheter has been inserted. For male, disinfect the meatus and glands in the same way as described in the preliminary disinfection. The foreskin must not be allowed to return over the disinfected meatus. Hold penis as shaft just below glands after disinfecting until catheter has been inserted. Please note, for both the preliminary and repeat disinfection process, a swab is for one-time use only. The non-dominant hand is considered contaminated once it touches the patient's skin. Insert the catheter. Grasp the catheter with forceps from the tip. Ask the patient to take a slow, deep breath and insert the catheter as the patient exhales. For female, insert the catheter 4 to 6 cm. After the urine begins to flow, continue to advance the catheter for another 1 cm for straight catheter and 7 to 10 cm for indwelling catheter. Please note, if the catheter accidentally touches the labia or slips into the vagina, it is considered contaminated and a new sterile catheter must be used. For male, lift the penis to a 60-degree angle to the body and insert the catheter 20 to 22 cm. After the urine begins to flow, continue to advance the catheter for another 1 to 2 cm for straight catheter and also 7 to 10 cm for indwelling catheter. Why lifting the penis in this manner is so important? Because in males, the urethra is normally curved, and this helps straighten the urethra for easier catheter insertion. Otherwise, damage can occur if the catheter is forced through physiological narrowing or at an incorrect angle. Allow the straight catheter to continue draining into the urine receptacle. For an indwelling catheter, connect the catheter to urine drainage tube and bag. For an indwelling catheter, hold the catheter and inflation valve between 2 fingers with non-dominant hand. Attach the prefilled syringe to the inflation valve and inflate the balloon with the designated volume of sterile water. Pull the catheter gently until resistance is felt to ensure that the balloon has been inflated and placed in the trigon of the bladder. Collect a urine specimen for analysis if needed. For a straight catheter, allow 5 ml midstream urine to flow into the bottle aseptically. For an indwelling catheter, it can be taken from the drainage bag this initial time only. Remove the jade catheter when urine flow stops. For an indwelling catheter, label it with label sticker. Secure the catheter tube to the thigh for female patients, or the upper thigh or lower abdomen for male patients with enough slack to allow usual movement. Attach urine collection bag to non-movable part or bed and place it below the level of the bladder. After the procedure, wipe any remaining antiseptic or lubricant from the perineal area. Ensure patient's comfort. Instruct the patient on positioning and moving with the catheter in place. Examine and measure the urine. Please note, in patients with urinary retention, no more than 1 liter of urine are to be drained at one time. Otherwise, it may precipitate acute bladder mucosal bleeding. Dispose all used supplies in appropriate receptacles. Remove gloves and perform hand hygiene. Document time and clinical rationale for use of a catheter. Catheter type, size, balloon size, and expiry dates. The amount, color, odor, and clarity of the urine drainage. Patient's tolerance of the procedure. Any abnormalities, such as presence of blood or sediments, if specimen was sent. Evaluation. Notify the doctor of the catheterization results. Report any abnormalities. Teach the patient how to care for the indwelling catheter, such as drinking more fluids and keeping the urine drainage bag below the level of the bladder. Here are the key points for today. That's all. Thank you for joining us. Bye.